Well, this was a very tough case, and so I'm very curious about what anybody have to say in this panel.
So if I may first say, I mean, the first thing if a patient walks in like this, I mean, the first go-to would be literally a facelift, an upper and lower bluff, and a neck lift. That's from a surgical standpoint. If you were to approach it from a non-surgical, minimally invasive standpoint, you actually then would approach it as a combination therapy with the neuromodulators, fillers, skincare, microtoxin, and laser resurfacing as well as radiofrequency microneedling for skin tightening.
First thing I would talk to about is realistic expectations. You know, I mean, a patient like this comes in and says, I want 30 units of Botox and that's all I want to do. You know, and I want to look like I am right. There's no way in God's green earth that you're going to be able to accomplish that, okay? So setting that realistic expectations, first and foremost is really, really important. From there, I just say, you know what, this is an ongoing process. You're not just going to have one procedure, you're going to have multiple. So I'm sure that's what you did. Aggressive. She needs to be on a good medical skincare program. Aggressive resurfacing. Volumization of the mid face, of the lower face with support. You obviously added some volume to her lips as well too. You used a neuromodulator. I mean, all these things. As you pointed out, accommodation therapy is really what all of us are doing nowadays. And with this, you really create synergy. You get this kind of result. Because honestly, if she came to my office, I would probably refer to someone like Dr. Kassir for a facelift. Because she's not someone that's depending upon her expectations, she may not be able to accomplish what she wants to accomplish with non-invasive or non-surgical means.
I have a couple of comments. First of all, what an incredible non-surgical result, and I commend you on that. So this looks like the other panelists have said that this is combination therapy. She's definitely had neuromodulators. She's had a multitude, I would expect a multitude of fillers in different areas. The skin has, I would guess, at least been resurfaced. And what's really dramatic to me, if you look at her eyebrows, she has hooding of the eyebrows that are asymmetric, and you've managed to not only make that much more symmetric, but you've repositioned her eyebrows, pretty much repositioned her face. So again, commendations. The one thing that I would, because Dr. Constantino wanted to talk about mistakes, draw attention to is the distance from her base of her nose to the top of her lip is really, really long. I would say it's north of 2.3, 2.4 centimeters. So to add a lot of filler to a lip like that would just make it look a lot worse, and that's when you get the proverbial duck lips, where you're adding filler to a long lip and elongating it even more. So be careful about that.
Any comment?
Yeah, so her hairline is a little bit receding in the temples, so we want to definitely try to protect those areas. We can use topical medications, laser light therapy, platelet-rich plasma to do that. If it's severe, obviously we can transplant those areas. The lateral third on the brow is also looking very, very weak, so maybe try with some serums in that area. If we're not getting the boost that we want, we can transplant some hairs into those zones.
Beautiful. TJ?
I was thinking, looking at the upper third, the forehead, I don't think you can get this kind of result with just toxins. So there must be some sort of filling in the forehead as well as the temples, and I think that also contributed to the eyebrow lift. Now, Dr. Kassir, like I do NanoFat, and I realize you do NanoFat as well. I would say, would you say that this would be a good case for NanoFat?
Amazing.
All over, I think could give similar results, and the stem cells from the NanoFat can give that kind of skin rejuvenation that you see.
Well, I'll tell you what I did. So definitely aggressive treatment with a fractional CO2 at the highest setting. So it took a little while for her to recover. Then this is what I love Sculptra Aesthetics, because I can get this type of result with my Precise Sculpt technique, supraperiosteal. Obviously she needed more than one session, so she ended up having 3 sessions. Each session is 8 weeks apart. I did do frontoplasty, and that's, if you could see, to my right, I don't know if in camera is to the left, but you could see the frontal concavity is a little bit more severe on the side where the brow is more drooped. So we did use Voluma diluted with 0.8 cc of Lido, and trying to not only do the forehead, but also include the brow bone, so under the brow. And of course, I did the best I could to attempt by doing Sculptra in the piriform aperture to trying to shorten the distance between the tip of the nose and the lip. Improve a little bit, there's some projection, but there's a lot of bone loss, bone changes at our age. And then again, the neurotoxin to finish everything and trying to bring harmony to this face. That really I agree with everybody on the panel. This should have been a surgical case, but some patients, sometimes they refuse to do surgery and they just want to look a little bit refreshed, a little bit better. But I think with Sculptra Supraperiosteal, I can give them, to some of my patients, a little bit of almost like a non-surgical lift with injectable fillers.
The other thing that I just may add to as well, especially because since I do a lot of trainings for various companies with the PDO threads, so this patient actually would have also benefited from, and still can, is with the PDO threads to be able to do a brow lift, as well as if you place them in the forehead lines, they actually will stretch the skin, tighten it, build neocollagenesis. At that point too, it helps eradicate and get rid of those fine lines in the forehead, whether in conjunction with the neuromodulators or not. Also for the upper lip, the PDO threads, depending on which types you use, you're actually able to roll up and lift and pull up the lip as opposed to putting it in with filler. Because if you do overload the lip with filler on someone with that distance, as Dr. Kassir mentioned, you would roll the lip out and it would look like a sausage or duck lip, which people don't like.
Nice job as well too. Just curious, what were her expectations? I mean, I'm really focusing on that, but I think that I think that's a very, very important aspect of what we do. Was she happy? Did you exceed her expectations, or was she even hoping for more?
Well, I think by the look of the pictures, she was thrilled because she definitely is a patient that she says, I will never cut. And she wasn't expecting to look this good. She thought she was going to look a little refreshed, a little volume. But over time, when she started seeing the results, remember she did 3 sessions, so it takes a while to see the result with Sculptra. But even from the first session, there was an improvement in volume. People started noticing that she looked more rested, better. And it wasn't until we finished with all 3 sessions of Sculptra Aesthetic that she was actually able to see that she looked at least 10 years younger.